January 23rd, 2024, we were introduced to a stark reality. Ontario hospitals are stretched thin, and this is not simply because they lack the infrastructure, but because they are also often the first and only stop for many seeking healthcare. And this is why we agree with expert sentiment in that hospitals shouldn't be the first stop for Canadians seeking healthcare. They should be resorted to when hospitalized care is the best treatment option. The crux of our challenge? Well, we look to address two critical issues plaguing the current healthcare system. Firstly, nearly one-fourth of all emergency department visits in 2022-2023 were for non-urgent issues. That's over 1 million instances where people could have been helped outside the hospital walls, sparing the people from the wait and the system from the strain. Now, this is also related to the untapped potential in specialized care that is meant to deal with these exact issues. From eye issues that could be treated by an optometrist to dental concerns that end up in emerge, we're missing out on leveraging the full spectrum of healthcare providers. Conjunctivitis, for example, is one of the top 10 causes of avoidable emergency department visits in Canada, which both optometrists and pharmacists can manage and treat. But it's not just conjunctivitis. In fact, 1/3 of non-urgent emerge visits could be managed by pharmacists, underscoring a potential to alleviate burdens significantly. Dental issues are also a leading cause of non-urgent visits, and in this case, visits often result only in temporary relief rather than definitive treatment, highlighting the inefficiency of using emergency departments for dental care. Furthermore, musculoskeletal issues and a broad range of eye-related issues are also common reasons for emergency department visits, but are treatable by physiotherapists and optometrists, highlighting an opportunity for more effective care outside of emerge. You see, the overarching theme here is an over-reliance on hospitals for conditions that alternative healthcare providers could manage. Enter CarePoint, a bold step forward, an interdisciplinary clinic that consolidates optometrists, physiotherapists, dentists, and pharmacists under one roof. CarePoint is about convenience, but also about confidence. It's about knowing you can get comprehensive care in one place without the guesswork of navigating the healthcare maze. Think about it. The average Canadian goes to a hospital because they know their problem will be fixed, not because they know that a cardiologist is on call. CarePoint will operate in a similar way, where we will mirror the hospitalized centralized model rather than promoting a distinct specialization like optometry. It's all about convenience to improve patient satisfaction and ultimately divert some of the burden off of the urgent care system. But we're not just waiting for you to walk in with a problem. Think about how most of these professions work. They also reach out, encourage regular checkups, maintenance, and screenings. And this forward-thinking model is already proven to detect and manage health issues before they escalate, embodying a true shift from reactive to proactive healthcare. Thus, it'll be key for us as it'll help ensure we catch potential health issues before they escalate, hopefully enhancing the overall health of the population and significantly releasing the downstream conditions that could lead to hospital visits. Now, you might wonder who's footing the bill. Well, once again, think about how these already work. We're planning on leveraging the proven methods that are already in place for private practice models. So in terms of startup costs in optometry, dentistry, pharmacy, and physiotherapy, if a practitioner wants to open a private practice, they take a loan from the government, which is often very willing to give them money after they receive their degree. And the only difference here is that they'll be working all together in the same building with CarePoint. Thus, the practitioner is liable, not the healthcare system. It's a proven model where you graduate, you work for a bit, you get a loan to buy a practice, work in the practice, and then pay off the loan. Now, this is not to be confused with a model to privatize healthcare, as services will still be covered by OHIP or insurance like they already are if you walk into an optometry or dental office. Two drawbacks are obviously that covered services will be limited over certain durations of time, age groups, socioeconomic status, and sometimes these fields aren't the most accessible, with dentistry in particular heavily relying on private insurance. But these are just general drawbacks of the system, and it'd be unrealistic to consider it given our current project's framework and limitations. We simply cannot tackle every issue and have chosen to focus on geographical convenience with the hope that services do become more accessible over time, which fields are already trending toward, for example, dentistry with their new federal dental plan. This brings us to our last point. Who's to say these healthcare practitioners will be incentivized to do this? You need to be able to trust and collaborate with 3 other practitioners for this to really work. And I'm not here to sell you on my ability to do that, but I'm here to introduce you to my family. You see, we have all the volunteers in-house. My older sister is now a working pharmacist. My second oldest sister is approaching her final year at Schulich Dental School. I just got accepted to the #1 school of optometry in the world. And my younger sister is on track to going into pharmacy school. All of us Western students, proud and eager. So who better to start the first CarePoint?